In response to mounting evidence linking ultra-processed foods to a range of negative health outcomes in youth, policy experts around the world are increasingly advocating for mandatory warning labels on these products. The rationale is straightforward. Adolescents and young adults are highly susceptible to the addictive appeal of hyperpalatable, energy-dense foods, yet current labeling systems fail to convey the potential metabolic, behavioral, and psychological harms. Warning labels are being proposed as a strategy to shift consumption patterns, enhance public awareness, and mitigate the rising tide of obesity, diabetes, and diet-related chronic diseases that are manifesting earlier in life. Regulatory proposals are taking several forms. Some experts suggest simple, front-of-package labeling that clearly identifies foods high in added sugar, fat, salt, and industrial additives. Others advocate for graphic warnings similar to those used for tobacco products, emphasizing the risks of habitual consumption and the potential for metabolic, cardiovascular, and mental health consequences. More ambitious frameworks propose restricting marketing to youth, limiting placement of ultra-processed foods in schools, and pairing labeling with fiscal measures such as taxation or subsidies for minimally processed alternatives. The underlying goal is to counteract the sophisticated marketing and reward-engineered appeal of ultra-processed foods, which current voluntary labeling systems and nutrition claims do little to address. Global comparisons reveal a patchwork of approaches, with some countries taking more aggressive action than others. Chile, for example, has implemented front-of-package warning labels that have been shown to reduce purchases of sugary drinks and high-calorie snacks among children and adolescents. Mexico and Israel have enacted similar measures, linking labeling to restrictions on advertising and sales in schools. In contrast, many nations, including the United States, rely primarily on voluntary nutrition facts and industry-led initiatives, which research shows are often confusing, inconsistent, or ineffective at influencing behavior. The contrast highlights a critical policy gap. Without clear, enforceable labeling and complementary regulations, adolescents remain vulnerable to constant exposure to foods designed to override satiety and reward mechanisms. The public health implications are profound. Ultra-processed foods contribute not only to excess caloric intake and weight gain, but also to disrupted appetite regulation, hormonal dysregulation, and long-term metabolic vulnerability. Warning labels serve as a rare tool to provide an immediate, visible cue that these foods are not innocuous, particularly for youth whose cognitive and impulse control systems are still developing. By making risk salient at the point of choice, labels can help counter the aggressive marketing tactics that exploit reward-driven eating, impulsivity, and peer influence. Without intervention, adolescents are left navigating an environment saturated with hyperpalatable, highly marketed foods that can silently recalibrate taste preferences, increase cravings, and set the stage for lifelong, unhealthy eating patterns. Experts also emphasize that warning labels are only part of a broader strategy. They must be accompanied by education, environmental changes, and access to healthier alternatives to be truly effective. Simply labeling ultra-processed foods without addressing school and community food environments, social norms, and digital marketing exposure may limit the potential benefits. Yet, even as part of a comprehensive policy package, warning labels represent a critical opportunity to intervene during adolescence, a developmental window in which dietary patterns, taste preferences, and neural reward pathways are particularly malleable. The warning is urgent. Without regulatory action, youth will continue to face an environment in which ultra-processed foods dominate availability, marketing, and social perception. These products are designed to be consumed in excess, disrupt hormonal appetite signals, and reinforce reward-driven eating behaviors. The lack of clear labeling leaves adolescents unaware of the health consequences of their choices, while industries continue to exploit cognitive and behavioral vulnerabilities for profit. Public health experts argue that mandatory warning labels are not merely informative, they are protective, offering a tangible, evidence-based tool to reduce risk, curb overconsumption, and prevent early onset of obesity, insulin resistance, and other chronic conditions. In a landscape where ultra-processed foods are engineered to override natural regulatory mechanisms, the absence of clear warnings represents a significant public health failure. Implementing them is not just a policy option, it is a necessary step to safeguard the health and developmental trajectories of an entire generation.